You're listening to Let's Get Into It, the Association of Black Public Health Students podcast, where we amplify voices, build community, and empower future health leaders one conversation at a time. Enjoy the episode. Hi, everyone. Welcome to ABBHS's first and official podcast episode of Let's Get Into It podcast, where it's a podcast where we amplify Black voices in public health. Yay! Woo! Thank you. Thank you so much for tuning in to our first episode ever. We are glad that you are here and that you chose to join us today. For starters, my name is Jordan Hayes. I am your host of this lovely podcast. I am a now second year MPH student in the BC's department. And if you don't know what that is, it stands for Behavioral, Social, and Health Education Sciences. And this podcast was created for the Association of Black Public Health Students to introduce the student body to public health professionals who look like them and who are in the fields that they may want to enter into. And this is also giving professionals a platform to talk about their experiences, their paths, as well as what it's like being in their field. So, first off, today we have our lovely guest on the podcast, Dr. April Carswell. Woo! Okay. And Dr. Carswell, could you please introduce yourself today?
Hello, everyone. My name is April Carswell. I am an adjunct faculty in BSHES and Raleigh School of Public Health, as well as a full-time chief of staff in the Research Administration Office at Emory, as well as a full-time MBA student in Goizueta Business School at Emory. So I live at Emory. I have two children,
Yes.
and I am married. So I'm excited to be here and excited to be your first guest on your podcast.
I'm so excited for you to be here. Clock it, all of the accomplishments, all the education. Woot, woot. I see it. I see it. Okay, so So we have segments on this show or on this podcast. So it's going to, our first kind of segment is going to be how are we feeling? So before the episode, I gave you a pre-recording questionnaire and you filled it out. So we're gonna get into it and see what those answers that you wrote were.
Okay.
Okay, I'm pulling it up on my side. Okay, so the very first question that on the actual questionnaire is going to be what emotions are you bringing into today? And feel free to reflect on your answers.
Okay. So I think I said excited and hopeful. And what else did I say? I don't remember.
I think reflective.
And reflective. Yes, all of those things.
Yes.
I am all of that.
Yes, 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 yes. Okay. And on a scale of 1 to 10, how full is your cup today? From 1 being completely drained to 10 being fully energized.
So I would say nine. I'm full of energy. My cup is definitely full, but not in the way where I am drained. If it's full in a way that keeps me going, it keeps me excited, looking forward to the next day, looking forward to all that I have going on. So it's pretty full, but it's full in a good way.
Oh, perfect. I like that answer. It's not entirely full, but it's full enough to where I can get things done.
Yes,
Yes.
absolutely.
Perfect. And would you like to share why here? You basically explained what you were saying earlier of being currently in school full time, pursuing your MBA at Rosetta Business School, working full time, volunteering, having two boys who are in summer break. As a
Mhm.
person who's a camp counselor, I understand that very much.
I need to bring them to your camp.
I know I don't work at camp counselor anymore, unfortunately.
Okay.
But
Okay.
I just
I
I
understand.
I completely understand having it's just like the amount of energy kids are coming into the summer and then trying to juggle that with also their extracurricular activities. Completely understand that.
Mhm.
Okay, moving on to the next question. If public health was a theme song, what would it be? And you said, and if remind me correct, did you say They Don't Care About Us by Michael Jackson?
Yes, absolutely.
Can you please explain further? Because when I read this, I absolutely hollered. Because it's a
So,
little trip. It's a little
right.
trip.
So when I was thinking about the song, I was trying to figure out, like, I actually took some time to think about that. So I started the questionnaire and I thought, and I was thinking about, like, I wanted to encompass what how the importance of public health, because public health is extremely important. However, the current climate um, is not reflective of our importance, right? And so I think that right now, with all the administrative changes and the administrative um, like things that are happening across the federal government, the local government, within the CDC, right across the street from Rollins, like all the things that are happening, it just doesn't seem as though they don't care, but they also don't understand, right? And so that's what popped into my mind is they don't care because it's not making money, right, to them, right? And they don't understand the impact, the work that we do, the value that we bring because it doesn't the turnover is long term, right? It's a long term impact for what we do. And so yeah, I thought Michael Jackson was I was like, yeah, this is and I was listening to it in my mind. I didn't play it. I should
Hmm.
have played it, but yeah, I was like, yeah, this is it. That's the chorus is that's definitely it, how I'm feeling about public health right now.
I completely understand that. When I saw that, I was like, that is actually a really good song to choose because it kind of shows what one is going on in the field of public health, and it's also showing how outside perceptions and what people believe public health is. So,
Right.
which kind of goes into our last question on the questionnaire of what public health myth would you love to kind of ban forever? And you gave a few, and I love the ones that you gave. So the first one is that, of course, the field of public health is obsolete.
Mhm.
And the other ones were that vaccines aren't necessary and that there's poison in them, that natural products and remedies are always safer or healthier, and how detoxes cure chronic diseases, which is actually ironic because I did an entire final project my senior year of undergrad about how detoxes are really bad for people's mental health as well as people's physical health, and that there's no type of research showing that detoxes help you in like a nutritional sense. Like there's no
Mhm.
nutritional benefit to detoxes. Excuse me. So when I read that, I was like, I completely understand that. And then last one, public health providers are healthcare providers, which was an interesting one. Could you kind of talk a little bit more on that one? Because that one I've never heard before.
So I think that people confuse. So even so for me, I think this would probably be the simplest way to describe it is I have a PhD in social and behavioral sciences, so basically BSheets, right?
Yeah.
And because I have a PhD, I'm technically a doctor, but then they think that because we are doctors, we are medical providers, right? But that's not the
Mm-hmm.
case, right? So we help people, populations, large groups of people improve their health before they get sick. That's how I describe it. And so I think that that's a common misconception that if you're a doctor, then you're a doctor. And it's like there's no distinguishing between what a actual doctor is. I think that there's like just going back to the first one, I think that a lot of people this is gonna sound bad. And for me to be a first guest for your podcast,
It's okay.
I'm gonna kick the door in. There are a lot of ignorant people in the world,
Clock
and so
it.
they will believe whatever they're told without researching it for themselves. And so
Mm-hmm.
there's lots of misinformation, lots of very toxic information out there about like
Mm-hmm.
what is healthy, what's not healthy, and people we're in this social media age where if a social media influencer says it's healthy, then it's like we're running for it and we're going after it, and it's really
Yeah.
killing a lot of people. Like there's a lot of like research that shows that a lot of these things that people are putting in their bodies, all these like you mentioned detoxes, all that stuff, is like we have a natural detox, right? Like, and if you know,
Mm-hmm.
like we have natural ways to get rid of things and we have natural ways to remain healthy. And I think a part of our role in public health is educating people about like what is myth versus what is actually truth. And so I think that there's just a lot of misconception, a lot of misinformation, and it's like running rapid. And so um, with with all of the issues that the public is facing, like these new outbreaks, these new like diseases that are coming up every day, I feel like there should be some sense of urgency around under more better understanding of what public health is and are needed and why it exists. However, it would require, you're gonna get me on my soapbox, but it would require um, preventing people from getting sick, right? And because we live in America, which is a
Hmm.
for-profit, um, we have a for-profit healthcare system. It's not advantageous for people to not be sick. So for our environment or our economy, right? So
Hmm.
I think that's one of the issues that we're kind of fighting against that, and we have a president who is getting wealthy off of all the things. So I'm not gonna go there, Jordan. Okay,
Yes, yes.
but
Because we have questions as
okay,
to
yes, yes, yes,
leading up
yes.
to those.
Let's
So
get to the
yes,
question.
no, but yes, thank you for that. Thank you for that because everything that you're saying is absolutely like true, and it's kind of evident to where we are now in terms of the field of public health and what our fields look like, what our research looks like. So I completely understand what you're saying with that. Okay, going back, so our next segment is diving deep. So I'm
Okay.
gonna ask you a couple questions just about like your personal life or professional life, not personal life, sorry, and experiences that you've that have presented to you. So my very first question is, what has been the most difficult part being in public health or being involved in public health while being a person of color?
Um, I think the most difficult part for me is so I have I'll go back a little bit. So I have a bachelor's of biology, a master's of epidemiology, and then I have my PhD in social behavioral sciences. And so for me, the hardest part was being in rooms where people were talking about people of color as though we were like the scum of the earth, right? It was like they're just, they everything like everything was horrible with our so I did my um, I only went to school to get my master's in epidemiology because I wanted to understand the numbers. Like, how are they coming up with all these statistics? And we're like the worst, three times worse than this, six times worse than that, worse in that, whatever, like, child. And that when I was getting my degrees, I was really interested in infant mortality, child and maternal health. And then I ended up, of course, getting into like different health disparities research. And so, literally everything that I studied, it was Black people are three times more likely and six times more likely and four times more likely.
Hmm.
And it's like, why are we so bad at this? And so it was hard for the hardest part is seeing the numbers and not being able to fully articulate the why behind the numbers to people who are making decisions, right? And so you see, got kids. See what I'm saying?
No,
And
we
so I feel
understand.
like the as a woman of color, it's like trying to defend. Like when I'm in the room, it's like I'm supposed to represent everyone, and
Hmm.
then when I say something that's contradictory, it's well, you don't really understand, right? We're not talking about you, we're talking about them. And it's like, well,
Hmm.
actually I'm a part of them, right? So I can speak for not for the whole race. I don't want to be arrogant enough to say that I can do that, right? But what I will say is that I have some experiences that are reflective of the populations that we talk about, but then also I have the other side of it where I have experiences where people who are researching that population, right? And so I think the most difficult thing for me as a woman of color in public health is um, watching some of the most important research not being able to be published because it's not it's not academically it doesn't look sexy, or it's not there's no funding
Hmm.
for it, or it's not what the current topic is, right? So because of it's not important for administration, it's not important enough to be studied. And so um yeah, that's what I'll say.
I thank you for that because I completely understand where you're coming from. So I was a Emory undergraduate, I guess Emory alum in undergrad, and I was one of those individuals where I was the only Black person in those classes, and I didn't realize how little within my university there wasn't many Black public health
Mhm.
students. So I was one of few, mind you, and having the conversation with someone of kind of who's a little tone deaf or doesn't really understand why these different statistics or these different stats that they're naming are so prevalent within the Black community. It's like this is where like the concept of social determinants of health is important. So I completely understand of like being in a position where you have to explain to someone something that you don't know yourself reasoning until you do the research, until you do like the reading or but until you understand more from like an internal sense, like why it is and or sometimes the only perspective that you can give is what your experiences is.
Mhm.
And it's tiring being that type of person, so I
Mhm.
completely understand that.
Yep.
Moving on to the next question.
Okay.
Sorry.
No
I
problem.
realize I can't be yapping. So
You're good. Good.
the next question is what has your work taught you? Because I know you have a doctorate and
Mhm.
I'm sure you've done a dissertation and
Mhm.
I'm sure you've done so much other research-based things or anything like knowledge-based things. So I'm very curious, what has your work taught you?
My work has taught me that I can make an impact in a lot of areas, and that it doesn't have to be. Once I've completed my dissertation and graduated with my PhD, I went into consulting for a couple of years and I hated it. And so
Mm,
in consulting, I realized it wasn't really the work that I hated. I didn't like that I was so far removed from the people, right?
mm,
So when you have a social background, social and behavioral background, you want to be near the people. You want to make an impact. And I felt so far removed. So we were evaluating the company that I worked for in consulting. We were evaluating public health evaluation. So CDC like programs that they were implementing. We were evaluating the programs to see if they were effective. And I just felt so far removed from it, and so far removed from the important work. And so I feel like um, a public health degree is very flexible. And so since leaving from consulting, I've been in research administration for a while and then also teaching adjunct, which I absolutely love. And I feel like the my experiences in the work has taught me that we can do like our skills are very transferable,
mm,
and that we don't have to kind of limit ourselves to the health department, CDC, um, universities. Like there's so much more that we can do with our degrees, and I think that that's one of the things that I try to tell my students. So there's a lot of avenues that you can kind of go in. It's just deciding what you want to do with your degree and what you want to do with your life. I think a lot of us go into public health because we want to help people, and
mm,
then we realize that there's so many people to help, right?
mm.
And you get overwhelmed, and it's like, I can do all these things, right? So, what do I really want to do? And so, I think that's um, one of the biggest takeaways that I would say that I've learned from my work is that I can do a lot of things. And it's just deciding on what I want to do at the time. And I don't have to figure it out all right now. I just have to decide what I want to do right now and then figure out how I can build from there on my next. So, yeah.
Very nice. And just out of curiosity, what class do you teach?
So I teach the foundations of public health research methods, something like that. It's like research methods in public health. I
Mm-hmm.
teach that one, and then I also taught grant writing for a couple of years. So I taught the
Very
very like
nice.
intro, like the first semester, first year, and then the last
Mm-hmm.
semester last year in the master's program. And so um, I didn't teach the grant writing class last semester because I had a heavy load for my MBA program, and so I didn't want to like shortchange the students because I actually love teaching those classes.
Mm-hmm.
So yeah, those two classes.
So if there's anyone out there that's listening to this podcast, that I'm pretty sure if you're a BC student, you have to take research methods.
Yes.
You can take it with Dr. April Carswell. So
Yes.
great. Okay. Now my that was just a shameful plug. Anyway, okay, last question. In terms of the segment, where do you see yourself in your work in the future?
Um, I don't know. Honestly, I feel like my shift is going. So I really love strategy. I've learned that I love strategy. And so I am wrapping up my MBA at Emory. And so I'm trying to figure out how I want to apply the MBA degree to something larger. And so I thought about starting my own consulting firm or even doing some like strategy on the healthcare side. But I feel like there's so many, like I just have to figure, because like I mentioned before, I feel like there's so many things we can do. I just have to figure out what it is I want to do. And so um, I know I want to help people. I know I want to make an impact. I just have to figure out how I can do that in a way that's lucrative. Mhm.
Hmm.
And a way that makes sense for the stage of life that I'm in, because that for me, that's also important. My little ones, I can't, you have limitations when you have a family. And so, um,
Hmm.
so yeah, I don't And with the landscape of public health changing so much right now, there's just lots of uncertainty around the short-term future of public health. We know that public health is extremely important, right? So we know that it's not going anywhere. However, the roles and the opportunities that are available to us are shifting a little bit. And so we have to figure out how to shift with them. And so once the dust settles, i.e., we get a new president, then we'll figure out
That
what's
part.
available for us and how we can kind of adjust so that we can fill in the gaps and kind of repair what has been broken with all the restructuring and all the things. So,
Yes. I feel like I'm in the same boat as you. I came into the field of public health of just like wanting to know or have so much knowledge and to really kind of figure out what I want to do with my career. And kind of similar to you, of like, okay, where can I, like, there's so many things I can do, but where do I fit in all of this? Like,
mhm,
where does the passion lie? And also, too, thinking about economically.
mhm,
I'm straight out of undergrad with in my master's. So thinking about, okay, do I still want to go back to school after graduating with my master's, or do I need a job? I have student loans. I need to pay off the loans. So it's like, and it's like, oh my gosh, I need to get a job, I need to get a job. But everything within the field that I'm in is constantly changing. So it's like, how
mhm,
do I kind of think forward and think towards the future? So I completely understand with that because I'm in the same boat as you.
mhm.
Okay. Thank you so much for those answers. We're going to move on to our next segment.
Okay.
So, with your experience and the work that you've done over the years, is there anything you would say to students in terms of what they need to know to coming into public health?
Um,
So much stuff, so many things. I get
so many things. You're right.
it.
So the last class that I taught was um, the research methods course, and I actually still mentor these students. I had a group of like all I told all my students like if you are entering public health, and they were all first year, first semester students, that I feel like it's very important that you understand the business of public health, right?
Mm,
There's a lot of, and I don't mean this in a negative way, but I feel like public health, we teach students in public health how to work, right?
mhm,
Other fields teach students how to lead, right? And
mm,
so I think it's important that we understand how to be leaders in public health. And
mm,
so, what does that look like? That looks like learning how to um, administratively lead. So, budgets, learning how to develop budgets, learning how to plan and think strategically, not thinking as a doer, but as a leader, thinking about someone who can kind of come up with ideas, conceptualize, strategize, make decisions, right? Use data informed decisions, but also using common sense, right? Because data is not always like the end all be all. And so being able to have those types of skills where someone can come to you and ask you, okay, how do I do this? And not in a way where it's asking you to do it, but it's asking you to give them advice. I think a lot of our students are, I mean, we have some very bright, very amazing students. I think that just the field though of what our field is not is undervalued, and so
mm,
getting some additional skills on how to lead, so taking leadership classes and taking classes around business development, and really understanding the higher level facets of public health will help you in the long run. I Last semester I brought several of my colleagues in. So one of them is a she had her own consulting business. Another was working for the CDC for a while, and they all were saying that they wish they would have known more about how to operate a business, right? Because once you have the
mm,
skill, you can make anything a business, right? So, if you, as you all know, any skill that you have, you can turn into a business. But you need to
mhm.
learn how to work the business and operate a business successfully to make your business successful. So,
Absolutely.
with the frailty of our economy and the volatility of our economy right now, especially around
Hmm.
public health. If you're getting a degree, you need to learn how to sell it, right? So, how are you going to sell your degree? How are you going to make it so that when you are done, you're not having to go back to school because you can't find a job, right? You can go back to school if you want to go back to school, but not because you have to. So, making it make sense, getting the most networking, getting the most out of your experience, but then also figuring out how can you level up, right? Don't just get what your peers are getting, figure out how you can add to that, and take some classes outside of BSHES and outside of the School of Public Health to kind of set yourself apart in your skill set and what you can do. So that's what I would tell my students. That's actually what I do tell my students. So
Yes. Oh my goodness. That's really interesting because I like, I guess hearing other students too, like, you're correct when you say like a lot of public health students, we learn to work and work through and to plan and to organize to do all these things, but it's also thinking about like you really think about like the purpose of what you're doing and thinking about how it can lead through instead of just like joining a pack, if that makes sense, or like a group of people doing one thing, but like it's okay to do that, but I also feel like you should have your own like kind of independent passion and still work towards that because that will keep making you thrive and make still help you kind of show up for yourself and also for the work that you do. So I like that. I've never heard of that. Like in terms of like other things I've talked to people, I've never heard that advice before. So I like that. Okay. Our last segment of this podcast episode is going to be what do you want to say to the people? So it's basically promoting yourself. If you have anything happening within your life or your work that you want to point out, promote, amplify, communicate, anything of importance or anything of passion that you feel like, hey, listeners need to know this about the work that I do, about the things that I do, this is the segment to do so. So, do you have anything for us, Dr. Carswell?
Um, I don't honestly, so I'm not really like that person. So I'm not really like big on social media. I don't have a platform that I'm trying to promote or anything like that. I think more than anything, I would want listeners to know that it's very important that you build like kind of like what you were saying before with not kind of following the pack, but you figure out how you can make yourself stand out, right? So right
Mm-hmm.
now, even while you're a student, while you're trying to figure out and get through classes, like what about you makes you unique, right? Because in this field of public health, there are a lot of us, right?
Mm-hmm.
And not only are there a lot of us, but we're competing with people who came from the CDC and who were laid off and they have 20 years of experience and 15 years from experience. So how are you going to differentiate yourself? Think about that now while you're a
Mm-hmm.
student. Think about that now while you have the protection of school, right? Like how am I going to structure my next and how am I going to structure my time while I'm here in this program to make me stand out so that I'm not flailing when it's time to graduate, right? So one of my things that I tell my students in my um, grant writing class is now is not the time for you to be excited about like school, right? School, your mind about school should be turned off. And now it's the time, what am I doing next, right? And so I think we turn that switch on, the next switch on too late. And we don't understand the importance of the now. So I make sure I preach, right? I make sure I really instill in my first year students that you need this is a time to network and network outside of BSHES, but because the natural network is in BSHES, right? But network outside of BSHES, figure out who you can meet, what kind of things you like to do, find opportunities now so that it's not, and so that you can kind of build up your skill set and figure out what it is you like to do. And what
Mm-hmm.
you want to do. I always tell my students the way you figure out what you want to do is by finding out what you don't like to do. The way you figure out what you don't like to do is to ask questions and then do it, right? That's
Mm-hmm.
the only way to do it. And so I think that it's really important that we be more strategic and more thoughtful in how we approach education and our experiences because time is the only currency that once we spend it, we don't get it back. And hindsight is
Mm-hmm.
always 2020, right? You're like, oh, I wish I would have. Well, figure out, really be intentional and strategic about what you think you want to do. Figure it out quickly if that's the path you want to go down and then go after it, right? Schoolwork
Mm-hmm.
will be there. You'll get your degree, you'll finish all of that, but really be mindful about how you can be in charge of your journey, your story once you graduate. Um,
Mm.
I think that's a lot of my students felt like they didn't know what to do when they were done. And it's like you have to think about that the first year, which is why I'm excited about
Yeah.
teaching the first year students because I feel like that's something that they need. I know you're like, oh, I just got in school, I'm focusing on school, but school is just
Mm-hmm.
one part of
One
it, right?
part of
So
it. That is, I,
yeah.
I like that you said that because it reminds me of so many conversations I've had with undergraduate students who are now graduated
Hmm.
now. And me being like a person who's already graduated and they're looking towards me for like advice, like, oh, Jordan, what are you doing after post grad and stuff? I'm like, I'm in school right now. But they're like,
Mhm.
oh, but like, they're like, oh, but what if you're not like in school and you decide like, oh, I want to get a job? I'm like, have you been applying since like junior year or senior year? And they're like, no, I haven't. And I'm like, okay, let's start there.
Mhm.
Um, and it's like, and it's so interesting because like, I think because of how kind of our society works, and especially being like a college student, your goal at the point, depending on who you are, but I feel like the goal is very much okay, I need to finish school. I need to
Mhm.
finish this class. I need to get to the end of it. And you're not thinking about, okay, what type of person will want to show up as after school or what type of person, what type of professional I want to be. And I feel like if you're not in like a leadership role, if you're not in like a setting where they train you for that, you never really think about it until it's like you're done with school, you're at home, you move back home, and you're just like, what am I going to do with my life?
Mhm. Mhm.
And like you were saying, it's important for you to start early. It's
Mhm.
making me think like the people who have like 1 year plan, 5 year plan, 10 year plan are actually onto something
Mhm. Mhm.
because you're thinking ahead. But
Mhm.
I feel like I was one of those people, and then my plan kind of like got got into flames and was shredded and tear it up. So I feel like I'm one of those people that's like make a plan, but also don't expect that plan to kind of go the way you want it to be. It like your journey's not going to be linear, but like know what you want to do. And it's very real that like a lot of undergrad students after school they don't really know what they want to do. They just like, okay, I have my degree.
Mhm.
What else can I do with it? And I'm like, try to figure out what your passion is. I'm like, passion. And I'm like,
Right.
like it's not all about the money and the success and like all these things. Like, yes, you might have that down the line if you choose a pathway that gets you there, but
Mhm.
like, are you going to be passionate about it? Because at the end of the day, your position is extension of other people and it affects other people. So
Mhm.
I completely agree with that. Like having a sense of, I guess, agency and knowing what you want to do within your pathway, within your field, and being really like honed in on it. So I like that answer.
Yeah. I think that
Okay. Yes.
I would just add to that.
Mhm.
I think that a lot of times we feel like we're supposed to know what we are passionate about or we're supposed to know what we want to do. I think the best advice that I give my students and that I even tell myself is like you have to meet people. You have to be intentional about making connections because we are in a society now, unfortunately, with the age of AI and all of that, where you can't just
Hmm.
cold apply to a job and get a call back, right? You can apply to hundreds of jobs and never hear anything back. Cold applying, right? Just putting your application in, putting your resume out there because there's so many people applying for jobs, right? So the way
Hmm.
you get a job now is
Who
who
you
you've made an
know,
impression
yes.
on, who you've connected with, who knows what you're good at, who knows what you're capable of doing, who want to take a
Yeah.
chance on you, right? So you have to make really good connections and be intentional about really building up your network, right?
Hmm.
That is the one thing that I recommend people start as early as possible and as often as possible, meeting with people, putting yourself out there. Hey, I'm interested in this. What do you think about that? Or finding somebody who does what you think you want to do, and then asking them questions, and then in the curiosity, because a lot more people want to help than those who don't, right? And so in your
Hmm.
curiosity to open up things where they're like, oh yeah, I can show you, I can put you in contact with this person or can let you know about this thing that's coming up. I think that is how we are landing roles now, and that is how we are putting ourselves above the hundreds and hundreds of people who are applying for the same
Hmm.
job that we're applying for. So that's the last advice I would say is to really start connecting with people authentically,
Hmm.
not just because you need a job, but really because you
Hmm.
are curious and be very curious.
Yes.
That's the last
People
thing.
can tell when you're not genuine.
Yes, absolutely. They're like,
People
oh, you
very
just
much can
want.
tell. They always tell us at
Absolutely.
Rollins, 80% of jobs out there in the world, guys, were done by networking.
Mm-hmm.
And I was just telling my friend, she's like, I've been applying to jobs and stuff, and I haven't heard back. I'm like, have you started emailing people?
Mm-hmm.
She's like, no. Cold email. Send like
Mm-hmm.
50 emails a day. Well, not 50, but Send some emails, meet
Email,
people.
LinkedIn, yeah.
Right. Go to LinkedIn, bother people.
Look
Because
at like your
some,
alumni. I think BC has a very strong alumni. Look into alumni, connect with some
mm-hmm,
alumni on LinkedIn,
mm-hmm,
post about what you're doing, what you're excited about, what you're passionate about, because people see it. And then once, even if they don't know you, like there's a young lady who went to my undergrad and she was requested to be my friend on LinkedIn. And so all these things that she's doing pops up. And I'm like, oh, she's doing really great. And I don't know her. I've never met her before. She's never reached out to me besides requesting to be my friend on LinkedIn or to follow me or whatever it is on LinkedIn. And I see her a lot on my timeline. So she's getting ready to graduate. And so if she reaches out to me for something based on because I've seen so much about her and I don't even know her, I will be willing to help her and of course mentor her or whatever she needs because she's
mm-hmm.
visible. And so I think that's another thing, like being visible is
Yes.
important. So
Yeah,
I'm
showing
pretty
the
sure I said it high.
face, showing your
Yeah.
face and yeah, in conversations.
Hmm.
Okay. Thank you so much for
You're
all
welcome.
of your responses. Thank you
Yeah.
for being here. Thank you for telling your story and speaking about the things that you've experienced in terms of being in the field of public health.
Hmm.
Because everything that you just said is so important and needs to be reiterated 1,000 times, especially because of the times we're in now and how unpredictable things are and how we're kind of all going through a slew of different emotions, feelings, and just unpredicted circumstances. So thank you. And thank you for taking the time out to talk to us, especially from like a standpoint of being in business administration and working one-on-one with students. So I just want to say thank you.
You're very welcome.
Thank you. And I guess this is kind of like a portion where I kind of promote ABBHS.
Okay.
Um, for anyone for anyone who is listening to the podcast now, please follow us on Instagram. We are Emory ABBHS on Instagram. We also have our hub website slash follow area. So please look us up. We are trying to increase our following. We are trying to increase the amount of engagement that we get. And if you have any questions about either being on the podcast or getting an interview or having a question for a speaker on the podcast, please DM us in our Instagram. That is the only way you can contact us. Or if you're on the group me, send a message in the group me. I want to thank you everyone for listening to our episode today. Thank you, Dr. Carswell, for being our very first guest on the podcast. Woo!
Woohoo!
And I wish everyone a beautiful week. All right. Thank you guys for listening and have a great day.
Thank you.
Thank you for listening to the Let's Get Into It podcast. Remember to stay informed, stay inspired, and we'll see you on the next episode.